Thank you very much. So today I'm going to talk about the importance of a cultural and social understanding of chemsex in the HIV response. Chemsex is a term that was originally used by gay health service providers in the UK to describe and respond to the use of stimulants for sexual purposes among gay and bisexual men, usually in the context of sexual encounters arranged using smartphone apps such as Grindr. Chemsex must therefore be understood as a cultural phenomenon that first emerged in urban gay centres in the context of three interlocking social, cultural and technological developments. Firstly, the availability of certain psychoactive stimulants, typically crystal methamphetamine and GHB or GBL. Secondly, the emergence of online dating sites and smartphone apps that enable the easy arrangement of casual sex between men. And thirdly, the availability of effective antiretroviral therapy that has altered the meaning and likelihood of HIV infection. In particular, the consistent use of antiretroviral therapy on the part of HIV-positive individuals reduces the chances of onward transmission, while HIV infection is itself no longer regarded as a death sentence, but a chronic manageable illness where treatments are accessible. In addition, the use of antiretroviral drugs as a form of pre-exposure prophylaxis on the part of HIV-negative men effectively protects them against HIV infection. However, as we know, affordable access to PrEP is unevenly distributed. So, concerns about chemsex first emerged in connection with sexual risk-taking and HIV risk. Rising rates of HIV infection in London were attributed to the disinhibiting effects of crystal methamphetamine by many of those who were newly infected and also by HIV prevention specialists and medical researchers. The attribution of sexual risk-taking to the use of stimulants is a little bit simplistic because it makes the drug responsible for a more complex behaviour. Crystal methamphetamine is valued by gay men precisely because it enables them to overcome reservations about engaging in disapproved forms of sex. It is said to give people the confidence to initiate sex and to try things that they might otherwise feel too shy or too awkward to ask for. The drug is, in other words, used to construct a different materiality, less structured by concerns around HIV transmission, for example, or cultural inhibitions around sex between men. So, disinhibition is one of the values or meanings associated with this drug and one of the reasons that people find it attractive and want to use it. The term chemsex was also coined to make a case for non-judgmental, gay-friendly, culturally competent drug treatment services. Gay men seeking help from drug treatment services to manage their use or reduce their drug dependence often encountered a lack of understanding about gay culture and gay sex in the services that they accessed. The existence of the word chemsex helped government drug services and managers develop support programs that were more tailored to the needs and worlds of this client group. Not all people who use chemsex drugs require these services. There are many gay men who are able to manage their use. But for those men who do run into problems, it's important to be able to access treatment and support services that are not homophobic and that are conversant with the social and cultural context of gay sex. Unfortunately, efforts to define and describe chemsex have also produced sensationalistic media attention and a degree of moral panic that further stigmatizes drug use and gay sex. Gay men are constructed in these discourses as social deviants whose susceptibility to HIV infection can be explained by their use of illicit substances and their transgression of social norms. It is in fact possible to use crystal methamphetamine and other stimulants and avoid HIV transmission and drug dependence, especially where antiretroviral therapy is accessible and barriers to care have been addressed. The stigmatization of people who use drugs, gay men, casual sex, and HIV positive people works against effective HIV prevention and gay men's healthcare. It's important to understand the social and cultural dimensions of chemsex in order to avoid these stigmatizing tendencies. Public health studies typically reproduce individualized and often pathologizing understandings of drug use. Chemsex is a cultural formation and a practice that has emerged in a very particular historical context, and it is impossible to generalize about the people who participate in it or their psychological states. Some gay men participate in this practice very infrequently. For others, it is a regular, weekly, or more than weekly activity. Cultural and subcultural meanings attached to drug use, historical moments, and geographical spaces all contribute to the making of particular forms of drug use and particular sexual practices among specific populations at different times. Understanding the meanings and identities and practical specificities attached to drug use and sexual practice will reveal possibilities for innovating community and institutional responses to the problems associated with chemsex, which are in fact highly variable among gay and bisexual men. It might also enable the identification of care practices that those who engage in chemsex adopt to look after themselves and each other and to prevent unwanted harms. The use of psychoactive drugs has in fact been a significant element in the formation of urban gay communities since the 1970s, at least in places like Sydney, San Francisco, London, New York, and other urban centres in the West. From the disco era in the 1970s through 1990s dance culture to the more recent emergence of chemsex, stimulant drugs have participated in the formation of significant social bonds among some men who have sex with men. Ironically, many of the sites that epidemiologists identify as pathogenic are also key sites for the elaboration of significant social bonds. In these spaces, participants are undertaking some of the affective groundwork from which relations of community, care, and connection may emerge. So it's true that the particular conjunction of sexual practice, digital technology, and drug types that chemsex names presents unique challenges and risks. However, the most effective response to this is not to further pathologize people who engage in these sex and drug practices, nor is it to inflate chemsex as the only driver of HIV infections, for there are many HIV infections among gay and bisexual men that take place outside of this context. Rather, the most effective response is to take the emergence of this phenomenon as an invitation to design culturally competent, non-judgmental HIV prevention and care services, as well as drug treatment services that will maximize the uptake of HIV testing and treatment among gay men generally, improve the accessibility and appeal of drug treatment services for gay men who require them, which is not everybody, and finally, embed these in cultural, community, and peer-based frameworks that gay men find appealing and accessible and relevant. Thank you very much for listening to me. And I've made some suggestions here of articles that have been particularly useful in terms of studying and understanding chemsex, as well as thinking about ways of addressing the health needs of people who participate in this practice. Thank you very much.